the recording, so this can be shared for posterity. And I'm going to now talk a little bit about this model. So if you open this model up, you'll notice, as Andre had commented this morning, that AnyLogic models are composed of several pieces. And typically, there will be at least one main class, which is sort of the stage on which the agents will move about and be visible. Sometimes we have more than one main class, for example, if we want to examine alternative scenarios that involve alternative model structure. There's often one or more agent classes. In this case, we have a person agent class. There's only a single one. You'll find other models which have lynxes and hares, for example, or you might have, deer, moose, and elk, if you're from my area of the world. And then finally, there'll be a series of experiments down here, which essentially are each associated with one or more scenarios that involve running the model. If you open this model, there's two experiments there, and if you go double-click on person, you'll see that person is a hybrid object. So it involves a state chart, which is a particularly simple construction in this case. It's a somewhat stark sort of dichotomy between living and dead. This is actually not to be entirely dismissed. That state chart is there for a reason. We actually had a version of this in a pure system dynamics package, and we had only awkward mechanisms for capturing individual mortality. We wanted a continuous description of individual immune dynamics, but when it came for a threshold for individuals to die if a virus level went over a certain level, we didn't really have a sort of a comfortable mechanism for doing that. There are ways to force fit it, as Andre said, but it's an awkward thing to do, and it yields code that's both difficult to understand, potentially error prone, and really hard to evolve. So we have this individual. Some of their dynamics is described in continuous fashion and some in a discrete fashion. They're in exactly one state, either living or dying at this time. Again, mutually exclusive and collectively exhaustive with respect to this state chart. And then we have these dynamics which describe their virus levels as indicated by this stalk. This is AnyLogic's depiction of a stalk. We have uninfected cells and infected cells, and then we have a rather aggregate representation of immune system complement in the form of cytotoxic T lymphocytes. These are particularly cells that are involved in fighting infection, and particularly that kill off infected cells. This model that you see here was the result of publishing and some very careful lab work done in the UK by a prominent team that's been advancing the science of immunological modeling. And it's typically been built so that individuals are examined in isolation. And what our contribution was to this was the recognition that the processes here have relevance to. They speak to issues having to do with transmission of infection. If an individual has a high viral load, they're more likely to transmit the infection. If they're undergoing viremia, they may be more infective, such as in the early stages of HIV. And that confers risk upon other people. Similarly, if an individual has weak immune systems, it ends up impacting a variety of components of this system. For example, it ends up impacting how long the virus remains in their body. It ends up impacting how high the virus, how high a level the virus reaches. And these things, again, have impact on transmission. And so what we did is we took this model and using AnyLogic, we were able to build it into a network. The interesting subtext here is we started this work in a pure system dynamics package. And because I don't want to cast aspersions, there's some fine packages out there, and I'll just mention it was one of the most popular ones. And we ran this model within that package as a pure system dynamics model. each of these was a subscripted stalk in system dynamics. So there'd be a stalk called V, and then you'd have a V sub person 1, a V sub person 2, a V sub person 3, representing the virus of person 1, person 2, person 3, etc. So essentially, V was a vector, X was a vector, where each element of the vector corresponded to a particular person. And it was awkward. It was awkward in terms of our ability to describe it. And it was difficult to capture this effect of death, which is a discrete transition that we wanted to capture. But the further interesting phenomena was we weren't able to really, it was hard to understand what the model was doing. I'm from engineering background, and I have to say my early work with a lot of simulation models, being sort of a no-nonsense guy, used command line systems a lot, I thought, this simulation stuff is fantastic. The visualization that goes around it is mostly eye candy. And that was kind of my attitude for years, that's kind of fluff. It's not really, it's kind of for showing things to stakeholders. Okay, I'll grant that, but it really doesn't add a lot. And I was totally wrong, I have to say. From my experience now, the visualization can be A1 important for communicating understanding of what's going on with this model. When we put this model into AnyLogic, we immediately got visual feedback that threw away a bunch of best guesses for what was going on with the dynamics. Fundamentally, in a pure system dynamics package, we didn't have a nice way of encoding network connections. We had a connectivity matrix, for those whom that's a familiar concept. Ones and zeros. One if you were connected, if two people were connected, so it was a matrix in a given row and column, it would be one if the person associated with the row was in contact with the person associated with the column, 0 otherwise. So with this connectivity matrix, we express networks, and we would simulate things, and we kind of look at the waveforms for particular people, but we couldn't really get a sense of network dynamics, what was going on across the network. With this sort of model, we had that opportunity. So I'm going to show you some examples of these dynamics. What we've set this up to do is to have a depiction within the same visualization of, on the one hand, people's viral load levels. That's encoded with their color, and secondly, their CTL levels, their level of immune defense, which is fighting against this virus. And what you'll find is that there's a very interesting dynamic going on. A person gets infected, it starts to lead to infectious cells being built up. The immune system detects those infected cells, and this flow ends up building up immune system function. That as this immune stock of cytotoxic T lymphocytes builds up, it ends up draining the number of infected cells because the cells undergo lysis. The immune system kills the cells using apoptosis, and the cells die and through lysis, and they're replaced by uninfected cells. So we have this kind of immune dynamics, and what happens is the virus load level heads up first, and then the immune system activity follows it. And using this model, if we run it here in AnyLogic, I'll slow it down so you can see this. This is showing kind of viral load against across the population. Here we have individuals. They're arranged in networks. Each of those individuals has internal dynamics, such as we've seen. And if we speed it up again, we'll see that, and unfortunately the seed person is probably hidden here, but we'll start to see, there they are. Okay, so they're up here. We have this seed individual here, and they're going to now be exposing neighbors to infection. I'll show you the way in which that's captured in just a minute. And what you see is sort of infection building up in the neighbors, and then you start seeing their immune system responding to that. And what's going to play out here is very much a network effect, a network spread across this matrix of connections, whereby you have successive waves of infections as new whole sets of neighbors are brought into it. And here we have another set of infections, and it's going to be propagating to this new component here. So we use this model to examine some of the dynamics associated with infection spread. And the interesting, provocative thing that we wanted to look at was a hypothesis that was advanced by someone named Bob Brunham, who's a international researcher of international repute in the STI area, the area of sexually transmitted infection. And his hypothesis, which was stated qualitatively but really couldn't be examined computationally prior to this, was that when people were treated very quickly after infection, that it would blunt the immune response. In short, by quickly terminating their infection using antibiotics, the immune system wouldn't have time to build up. And so they would lose the opportunity to have built up significant immune defenses against a subsequent infection. So in short, premature treatment or overly quick treatment of individuals might be disadvantaging them in terms of it just predisposes them to the next infection. And we found that effects like this could go on using a system like this in a very stylized model. We have found further that sometimes the effects of vaccination could be overplayed in the sense that sometimes for infections that are less deleterious, exposure of individuals to infection can build up immune memory that is then long-lasting and then protects a substantial number of people. Whereas if you have vaccination initiatives, they can be very effective while they're well enforced. But if compliance ends up tanking, if compliance ends up not being maintained because of lower risk perception, you can get situations where vaccination ends up going, vaccination levels go very low, and there's little natural immunity in the population, and therefore there's vulnerability. So this model, this cross-linked model of immune dynamics on the one hand and infection spread on the other, was important for understanding at more of a sort of qualitative level some possible dynamics to explain puzzling epidemiological patterns we see within the population. And this ability to visualize it, while I'm sort of just playing with it as a toy here, was actually very, very helpful for us immediately grasping some aspects of its dynamics. What we see here is a graph of sort of cross-population mean viral load across the population. But while we run it, and I should have shown this earlier, you'll find that through AnyLogic's interface, you can actually drill down to the levels of particular individuals. So if we run this out just a little bit here, and Andre showed this earlier, but I'll see if it could be further illustrated here. We can actually take this model and drill down to the level of individuals in the population, and we'll see for a particular individual, for example, their viral load level. We'll see their levels of associated with their flows. So flow into viral load, or the viral load, flow out, flow in from other people, for example, up here, and flow out due to decay of variants over time. An interesting aspect of this ability to go in at the individual level is we could look at individuals with very different levels of immune strength. For example, individuals whose immune systems are weaker, and putting them in networks with individuals whose immune systems are stronger. The observation being someone from the northern hemisphere could be excused for thinking that flu must live only in Australia and other southern climes during the summer, because you can't really see it in the general population. In fact, it tends to live in nursing homes and hospitalized populations, individuals with very weak immune systems. And in a model like this, we can capture the effects of that heterogeneity. We can examine the individual level dynamics for those with weak immune systems and compare it to those with strong immune systems, and understand how that sort of mixed network, that heterogeneity, ends up impacting immune dynamics. So this is a model that's shared with you. You're welcome to look at it. The underlying model is solid and well published. The system exhibits some of the insights that can come from mixed models of this sort. Okay, so this is model 1. Any questions on that before I go on to model 2? Okay, for model 2, I thought I'd examine a clinic-based model. This is a model that I built with some clients in Ontario for a clinic that was used for training, actually, of chiropractics in Canada. And it involved a mixed model where we had, on the one hand, individuals represented as agents who could be in one of a set of states. This is a quite aggregate model, but we could represent people sort of as being in a chronic pain state. From that state, there'd be a certain chance that they would seek care. They'd either take walk-in care or make a booking ahead of time. And this model evolved in a way with a much more sophisticated scheduling system for booked appointments and that sort of stuff that I don't have time to go into. These individuals, when they presented for care, using a technique similar to what Andre showed, and I have several models which illustrate this, including one I've distributed to you folks, they injected themselves into a clinic here, whose flow was dictated by discrete event characterization. And they would be visually associated with a layout from an actual facility through which they would move on these sort of paths here, as is typical in AnyLogic support for this sort of modeling. Within this context, we have several sorts of rooms that throttle the ability to take in patients, that limit our throughput. One of them is a set of clinicians, one of them is a set of interns, and one is a set of rooms. And some of the more important questions that this model was designed to try to answer was, for example, if we had another clinician available, how much would that increase our throughput? Could we reduce waiting times by having another few rooms available in an adjacent facility for peak times? Those are exactly the sort of questions which we could try to address using a model like this. And this patient flow, while I don't have time to go into detail, it required the marshaling of several of those sorts of resources. For example, this HPD stage, which was only used for first-time patients, would be used to sort of elicit history of patients and would tie up an intern for a longer period of time. But then they need to get a sign-off from a clinician, and this would require obtaining a clinician, associating the patient with a clinician, so-called seizing a clinician for a certain amount of time. Patients who are not first-time patients would be routed through a different process. Now, in order to capture this differential treatment of first and non-first-time patients, and in fact to associate patients who have returned several times with the same intern every time, we required recourse to a detailed representation of the patients. We couldn't review entities, these individuals that flow through the system, as simply nameless, anonymous entities. We wanted to capture the whole life cycle. We wanted to capture the fact that as they flow through the system, if they received inadequate care, they'd be more likely to leave the system in a state vulnerable to easy relapses, or in fact to a situation where they represent very quickly because the pain never went away at all. And to capture that, to capture the fact that some people are first-time people, some people are not, we wanted to capture the dynamics after they left the system, went back into the population, and then represented. Hence this representation of persistent personhood out in the population. So if I go run this model, which I should mention also illustrates some interesting aspect of model testing. Down here in the lower part of the model, we see a population of interlinked agents. Interlinked not because there's transmission of risk factors for pain, but more because they can spread attitudes towards the clinic based on their history of transmission. So when an individual here presents in pain, once the clinic opens, they'll typically end up presenting for care. And you'll see here there's sort of clinicians here off on the side who are awaiting. And this facility up here has several rooms used for treatment. I'll speed this up some. So now we have a situation where we're simulating through the day on Monday, and some individuals have actually, I guess I've sped it up too much here, but some individuals have gone through the system presenting for care, etc. These individuals, when they present for care, they're routed to the rooms, and they secure treatment. The clinician comes and visits them, and then they leave the facility. And what we can do is we can actually look at the history of individuals. So, for example, we have some, in this model or its subsequent developments, we have mechanisms to track an individual's history over time and output that information to a spreadsheet. So for particular patients, we can track their longitudinal history of encounters with this particular clinic and of treatment by the facility, and whether or not they received adequate treatment at several encounters with the facility. So in this case, this network interplays with this top environment to yield sort of dynamics that can be measured both in terms of individual progression and in terms of sort of the throughput for the facility. We programmed in the sort of opening times of this clinic, and you'll notice that this is all quite gated by the time of day. So once the clinic finishes up the end of the day, no individuals will come in, and it will then end up reopening in the next business day. So this night will pass with no further activity, and then it opens up on Saturday afternoon, for example, and then individuals are cleared out, etc. So here we have a model which captures sort of the catchment basin, as it were, for a chiropractic facility, has individuals flowing in and then having persistent memory of their connections, and we can track sort of the adverse effects of very narrow thinking. For example, getting people through the system more quickly at the costs of lower quality will end up being blown back to you because people will represent for care sooner, and it won't actually lower it won't in the end lower the burden in terms of the amount of patients that you're seeing. In fact, it could lead to situations where patients end up going to other facilities. So this is a situation of sort of mixed agent-based and discrete event modeling. I have a third example, but before I present that, I want to ask, are there any questions on this sort of modeling? Andre presented the essence of it earlier, but questions? Okay.
You just mentioned about the entity agents.
Sure. Be glad to do that. So this is something which is going to become significantly simpler in the context of AnyLogic 7, which is under development right now. But currently, to capture in a seamless fashion this movement between, on the one hand, agents in the population, on the other hand, these entities flowing through this set of processes within the clinic, these entities that you see visually moving around in the clinic to rooms and so on. In order to get that interface right, we needed to have a little bit of finesse within this model. Specifically, we created a version of an entity that remembers its associated agent. And we called this person entity. And this person entity, in fact, is associated with a set of information that reflects some persistent pairings of the person, say with a particular intern. But they're created when they get placed into this discrete event flow. And it remembers their association with a particular agent, a particular person. And if we go look at that flow, this ends up being relevant at a couple of places. For example, when the individual is treated in this procedure here, which occurs after preparatory procedures, they are sent a message which basically indicates that they have been treated. So in other words, the entity, instead of being an anonymous sort of faceless being that's passively sort of operated upon within this context, it's associated with a person, and we can send this person a message which basically says, okay, you've been treated now, person may end up evolving in a situation which allows them to leave this this pain state. And in this particular simple context, excuse me, it's this transition here. If they receive a message that indicates they've been treated, they're viewed as leaving the context of pain. So in this case, we need to essentially have a special variant of this entity which keeps track of the associated agent. And with that finesse and a small one or two other little pieces to get them into the clinic system in the first place, you can easily sort of unify the two of them. So we have more evolved models of this sort. This is just an earlier version of this, where there's differential outcomes of the individual based on the treatment of the facility, and it's not assumed in any way that the treatment is successful. In fact, quite the opposite. So so that was the sort of nexus between the two. So thanks for that question. Any other questions about that or comments before I go on to my third sort of little hybrid model that we have? Okay. The third model relates to a sustained project that we've had going on for the past several years, which has been in the area of West Nile virus. So do you folks have West Nile down here? No. Okay, you're very lucky. Sorry?
Ross River.
Oh, okay. Really?
Ross River.
Oh, okay. So West Nile virus is a flavivirus that originated in Africa. It's associated with quite mild outcomes within the African context, but in about, I think it was 2003 or so, early 2000s, it made its way over to the US, presumably in an animal at the Bronx Zoo. And a particularly nasty variant of it has now been circulating in North America. And our province happens to be, because of the vagaries of its ecosystems and habitat, particularly the prairie ecosystem, it's at the epicenter of West Nile virus infection in North America. And in several years, hundreds to low thousands of individuals have been infected and presented for care. I think it was 900 in 2007. What makes this particularly difficult to reason about is some years it's there's almost no cases, and then in some years it just goes gangbusters and it blows up. And naturally, when provincial healthcare agencies are looking for economies, this is one of the first things that they're tempted to cut. And one of the things our model shows is just how short-sighted that impulse is. So we actually have a quite articulated framework that combines together dynamic models in the form of system dynamics models and here agent-based models with decision analysis. Decision analysis looking at a week-by-week situation with current temperature, mosquito levels, to try to understand under what situations you should trigger intervention, and comparing that to other things like an emerging vaccine that's coming out for this virus. So we actually have a very much a multi-model approach here, which even crosses outside of dynamic modeling to decision analysis. It's a very powerful tool, and for those who are interested, I could share some slides with you. In this particular case, what I wanted to highlight with you, however, was a different aspect of it, which is the hybrid with discrete event modeling. And this is actually more of an early sort of a mock-up of this. We have a system dynamics model that we're in the process of calibrating, and once we finish that, we'll probably be updating this a little bit. But fundamentally, we have an underlying system dynamics model which characterizes bird populations on the one hand, mosquito populations on the other, and finally human cases. And in all cases, we're representing these with stocks and flows. And I apologize for the limited aesthetics of this model. This is actually imported automatically into AnyLogic using from Vensim, and it actually did a fine job in terms of the operation, but the aesthetics are things that only an engineer could love. Fortunately, that's me. So actually, I don't love it, but I tolerate it. So here we have stocks associated with birds, for example, and flows as birds get infected. Could we do this in an agent-based framework? Yeah, we could simulate all the birds in Saskatchewan. It's unclear what the benefits of that would be, since we have actually quite limited knowledge of appropriate bird ecology, etc. Simulating mosquitoes in Saskatchewan would be an exercise in futility. And people have built agent-based models of mosquitoes for malaria. I've met modelers who actually simulate mosquito perception of desirable egg habitats and so on, but it's never going to scale to this sort of size. You do it for very focused studies, more basic science type work. In this case, we have a very pragmatic goal. We want to inform our health regions within our province so they can do effective planning. And the pragmatics here clearly pointed to aggregate models for the underlying dynamics. And however, we want to capture geography. And it turns out that doing so in a pure system dynamics package is possible, but it is the aesthetics are significantly worse even than these diagrams. So what we did is we created a hybrid model which involved the population of patches. These patches, each patch is represented as an agent, and each agent includes the stocks associated with, stocks and flows associated with the mosquitoes and the birds and the people who live in that area. And different areas can be quite different. So you may have, for example, more mosquito habitat in some areas than others. An area with lots of potholes, prairie potholes, or adjacent to a river may lead to faster mosquito population growth, etc. So in any case, we have this model which includes stocks and flows associated with these various populations, and then we have these patches, and then we have migration of birds between these areas. This, for example, these susceptible bird migration here, we actually have birds coming in from sort of neighboring patches, and there's a certain amount of mosquitoes coming in, although because of their smaller range, less so. And then what we do is we can simply simulate this model over the different patches. And again, this is more of a proof of concept model, so the it's designed to allow you to set up. Well, maybe we'll do a smaller one at first. What we'll get is a set of patches, each associated with its own sort of unique dynamics in terms of birds, shown in red, in terms of mosquitoes, which are shown here in blue with depth of color or saturation indicating sort of the level of mosquitoes in individual human cases, of which there are very few at first. And what you'll see is that there's kind of a dynamics associated with spread between these. I think I'll turn this to AnyLogic sort of maximum speed mode. So here we have birds here, and each of these is calculating the updates to the bird population, the mosquito population, and the humans in various health states. And essentially we're simulating a set of 100 coupled differential equations, which are quite extensive even within a patch for each of these areas. And by simulating this out over time, you'll find these patches evolving in their color, representing both internal dynamics, endogenous dynamics within a patch, and the migration of birds between patches. Birds are associated with very high viremia levels, and so when they come into a patch, they can seed the mosquitoes with West Nile virus within that patch. And what you see here is a very adverse situation characteristic of high temperatures. The model is parameterized by temperature, and so you can have different temperature time series, etc. And you see additional rates forming here among mosquitoes in parallel to that. Proof of concept model, but what this illustrates very much is sort of a geographical mapping component. Later, we'll see a very different sort of geographical mapping at the agent-based level with agents moving around in geography. But this is an illustration about how we can break up into regions, each of which is described in an aggregate system dynamics model, and use it to simulate evolution of the broader system and the coupling. So I think those are all that I have time for here. Are there any questions in the final couple minutes on any of these sort of example hybrid models? good.
I know.
And we'll end up reforming in.
Yeah, well, I think it's supposed to be 15